So today we're doing a focused respiratory and cardiac assessment on Toni Rivera. As always, knock on the door, perform hand hygiene, introduce yourself, and use 2 patient identifiers. For past medical history, he has hypertension, osteoporosis, hyperlipidemia, STEMI, myocardial infarction, autocoronary bypass graft. He has past surgical history of coronary bypass, a family history of both parents being deceased, and 6 siblings in total, with 2 still alive. His medication history includes being allergic to penicillins and stating that it makes his throat swell up. His current home medications are calcium, Fosamax, Metropol, Sosinate, Lipitor, Tylenol, and Motrin. His social history consists of 1 drink per year or so, does not report smoking, denies street drug use, lives with spouse in a 2-story home in the city, has 3 children and 7 grandchildren, claims to keep busy with gardening and other handiwork. He is retired, and it is unknown his highest level of education and his nutrition and exercise. For diagnostic history, he had an x-ray that verified right femoral neck fracture and osteoporosis. His BMP showed a low serum sodium. His CBC with differential, electrolytes, coagulation screen, and PT-INR were all within normal limits. For the subjective data, he did not report fatigue. The skin color and temperature was within normal limits. Does not report how many numbers of pillows are used, but does report shortness of breath without exertion. The patient reports chest pain. There is no cough present, no swelling in the legs or feet present, and does not report number of times awake and at night with an urgent need to urinate. The respiratory assessment subjective data includes no cough present, no phlegm or blood in the sputum, shortness of breath is present, no fatigue present, chest pain is present, city living can affect the breathing, unknown last TB shot and chest x-ray is scheduled, unknown last pneumonia vaccination, chest is flat but breathing effort seems to be labored, patient reports shortness of breath, and no chest tenderness, crepitus, or masses present, but does report chest pain. Chest is flat and symmetrical, anterior, posterior, and laterally. The client's nail, skin, and lip color are within normal limits. There is no chest tenderness, crepitus, or masses present upon palpitation. The chest wall is symmetrical and flat. Pulses are 120 at carotid and 5th intercostal space. No masses or crepitus present on pericardium upon palpation. The aortic area is bounding, pulmonic area is bounding, tricuspid area is bounding, mitral area is bounding, and apical pulse is 120 beats per minute. When auscultating the client's posterior, anterior, and lateral sides, you want to start with the posterior, starting from the top, working your way to the bottom in a zigzag motion, counting from 1 to 10, then working on the lateral side, counting from 11 to 18, alternating sides. Then the anterior side, starting with the top again at 19, working your way down in a zigzag till 26. No murmurs or rubs were present upon auscultation. Upon palpitation of the carotids, as previously mentioned, it was a rate of 120 and bounding. There is no jugular vein distension. Now palpating the pericardium, finding the 5th intercostal space and the midclavicular line for the apex. Now auscultating the aortic, pulmonic, Erb's point, tricuspid, and mitral area.